I'm a consultant dermatologist in a big dermatology department in an NHS London teaching hospital, and I set up a hair loss clinic myself 8 years ago and have since set up a paediatric hair loss clinic. This is because I had a strong personal commitment, having had my own experience of suffering from alopecia areata and finding that there was very little information out there and furthermore very few specialists. I remember feeling a sense of panic and fear about what was going to happen. Was I going to lose my whole head of hair? And I felt stuck in a situation because even I myself as a dermatologist was not aware of all the treatments that could be provided. And it became a very distressing time for me because as things got worse, as I lost more hair, I would see this around the house and on the carpet, and at that point I thought, well, I'd like to do something proactive about it. Female hair loss is a very wide problem, and it can affect a woman of any age, from a teenager to a lady in her 80s. And the reason that people come and see me is because no matter what age, losing your hair has a big psychological effect. It can destroy your life, your social life, your image, your identity, because hair plays such a big role in how a woman looks and feels. I give my patients time to talk and tell me their story, and their story may go back 20 years, may go back to their childhood, any experience of hair loss in their youth, and all of this helps to inform me about the type of hair loss that they're suffering from. Having taken a detailed history and length, which gives me some pointers towards why this problem might have occurred, I will always examine the patient's scalp, a detailed examination using an instrument called a dermatoscope, which is essentially a small handheld microscope which allows me to look at the hair follicles, the health of the hair follicles, but also the types of hair shafts that are being produced by the hair follicles. And all of this gives me, as the consultation progresses, ideas which I will then relay to the patient at the end of the consultation with a summary of what we need to do next. And that may include investigations such as blood tests, a scalp biopsy. By doing a biopsy, that helps to inform my management of your condition, and input from a gynecologist, input from a psychologist, and part of the consultation as well is to explain what the steps would be after that. And in a single patient, there may be one cause, but in another patient, there may be 5 or 6 different causes. And you have to address each individual component in order to treat the patient. So I have a very strong belief in using a holistic approach to treat hair loss. It's like being a detective. It is about trying to investigate every possible factor that could be responsible or contributing to the problem. Nutritional factors, hormonal factors, stress in a person's life, and all of this has to be weaved together in order to make a comprehensive diagnosis and then a management plan using treatments that are directed specifically at those causes that you find. I often tell patients that there is absolutely something that can be done. In fact, there are many things that can be done. Our first aim is to stabilise the hair loss, so no, you will not go bald. You do not have to worry or fear going bald or your condition getting worse, because once you're under my care, I will make sure that we do not get into that situation. And the second thing to say is that many of my patients are often pleasantly surprised by how much can actually be done.